hearing as sites roll out is a predominance of military facilities. That's because those are being tested under a rubric identified by the federal government. We are also testing DEQ non-military sites throughout the state. Was that short enough?
That was a perfect 5 minutes. I appreciate it.
All right. Any questions on that?
Any questions?
Just, are there any sites in Flint and Genesee County?
There is one. I'm going to get this wrong, so I have to look at my notes, which I can't read. The Coldwater Road landfill. Now, in terms of prioritizing site remediations, one of the first things you look at is groundwater impact. The Coldwater site landfill has been being tested since February of 17. It was tested in June of 17. We're testing it again in December this month. On the south and the east of that site, they're already hooked up to municipal, so there's no impact to the residents. They have tested the area, I believe, to the south at a former GM facility. That is not non-detected. It's below 70 at this point. We are monitoring it. The issue is to identify whether it's leaching outside of the landfill, and if it is leaching, to identify what kind of treatment protocols can be put in place. Now, to be candid, treatment on PFAS is challenging. You typically use a carbon filtration system, but it depends. Frankly, it's a groundwater issue. So the whole issue is, does it leach, where does it leach, and how do we stop the leach? So there are containment procedures already in place there, but we continue to monitor it. Yes?
Petition.
Have we asked CDC,
Yes.
ATSDR, and or EPA for help?
We are actively engaged with EPA and CDC. DEQ's, I'm sorry?
ATSDR.
All of them, and a bunch of other numbers as well. CDC is really quite involved on the science end of this. EPA is involved, obviously, on the environmental issue. What we've asked of because all the states are sort of doing this at the same time, we are talking to the EPA about taking a more coordinated role in terms of what our best practices in terms of response, what is the best technology in terms of mitigation, so we all don't experiment.
Okay, we're going to move this agenda. General McNair.
Thank you, Mr. Chair. I promised that I would be shorter than George.
It's a low bar.
I can't promise I'll have it done in 10 minutes. You'll notice I added Ann's summary for 2017 to my title slide besides the word update, just because I want to give some context, as this may and probably will be my last report on behalf of the Fast Start program to this group, though I have been asked by the mayor to continue on FWICC as one of her representatives. Slide, please. This is Pittsburgh, Pennsylvania. This is not Flint. Slide, please. Pittsburgh is a lot bigger than us, and it is certainly wealthier than us if you look at that second bullet. I had conversations with Allegheny County this summer. They called me unsolicited to talk about what Flint was doing and their program. A couple key points there are the length of time that they estimate that it will take them to do this, even given the wealth of the city, and what we would think would be the abilities to do this. There's also there is clearly a conflict, I would note, between the city and county. It's one of those circumstances where the county and the city, you know, like Detroit and Wade County, or perhaps like Miami-Dade before they consolidated, where you've got a great overlap and responsibility in the same geographic area, an issue which I believe Flint has certainly worked through if it was ever there. Next slide, please. Unlike the Pittsburgh, Pennsylvania, we have a lot of successes, I think, that I want to talk about. You'll notice in the top slide that we say 3 years. Candidly, just as 6,000 replacements was a stretch goal, we are talking about completing this in 2 years or by the end of 2018. And I'll talk about that later, but a form of a stretch goal. The consent order, you don't always think of a federal order as a success story, but in this case, because of the actions of the state and of the city, to recognize this as an opportunity to institutionalize the plan that we have in place and the rate of funding on the state's behalf, this was an opportunity to say, okay, we want to truly institutionalize this. We want to create this in a way that it will be in place for the next couple of years. Remember, at that point in time, the mayor is facing a recall election, and she wanted to assure that there was that this plan would continue in place, and this was a way to do that. Of course, that didn't come to be. She had quite a mandate to continue what she's doing, and I'm thankful to the people of Flint, on behalf of the people of Flint, for that. I also have to consider it a success story, the partnership that we've had to work through these problems. I think the CLEAR program that George mentioned is just one of the exemplars of the way that we've worked very closely to solve this. The long-term water source has already been talked about. The tracker program I'll talk about in a minute, but it's clearly a success story, and we're continuing to work on the trust of the city residents. Next slide, please. You've already seen this slide in terms of how we came up with these objectives way back in February of 2016. I do want to note, however, that to get these objectives and get them down and state them so quickly this was exactly a week after I had started. It was a result of having a couple of conversations, one with Dr. Laura Sullivan, one with Dr. Hannah Atisha, and one with Miguel Del Toro, which, when I'm saying, where do we focus, on the one hand, I said, where do, Dr. Mona, where we got the most kids? Where you got the kids in the city, and the other one was, where do we have the greatest lead density, from Miguel Del Toro, and then I sort of refined these with Dr. Sullivan. So it was easy to say, and I guess I'm talking more about the criteria than the objectives. I'm trying to hurry too much here, Mr. Chair. When we see that slide, consider it already said. These ones here were broader in terms of saying, okay, what do we really need to do as of back then? Next slide, please. You know what, we can skip the barriers to success because, you all know these, and we've worked through most of these already. So I'll just talk about how we worked through the barriers to success to success. Next slide, please. So one of the issues, of course, is where, as I skipped in the last slide, we didn't know what kind of, what our service lines were, what their composition were. The city records, as I've said many times, were incomplete and in some cases incomprehensible. Incomprehensible because they're index cards that were filled out in pencil, and some of these go back to 1912, so you just can't read them. As we worked through this, starting with our pilot study with Rowe Engineering and working our way through the first couple phases in 2016, it's turned out the records were also about 64% accurate. This isn't a reflection on anybody currently in the city. These are old records. The other part with the records is it would either say L or C, and we didn't know if that meant lead or copper for the entire system, or if it was only, between the main and the curb box, or between the curb box and the residence. But based upon what we had, I believe it was U of M Flint put together this map for us, and you can see the color coding there, the green being the unknowns, was a great concern, even as great a concern as the red and blue. The blue, of course, was based upon learning that galvanized is just as bad or worse in some cases than lead because of its ability to attract and retain lead particulate to the galvanized. So we had our job cut out for us. Next slide. These are the criteria then that with the help of the individuals I mentioned that we were able to come up with. Some of the data was easy to come up with. We used the 2014 census data. Some of those, of course, are based upon the records. Some of these are really based upon just a head scratch as to looking at age of neighborhoods and say, okay, we had the greatest building concentrations in certain decades, like the 1920s and then the 1940s. All the homes are being built at the same time. So we're thinking they're going to use similar construction just to give us a place to start that makes sense to the residents of the city of Flint. Next slide. One of the things I think that was important to mention was We wanted to get out there and replace the first service line as soon as possible. This wasn't political with a capital P. This was really in terms of policy. We had to have a way to sort of highlight to the people that we had come up with the criteria, that we were working those criteria. So we did so. I forget the exact date, but we wanted to make sure that we could show the people that we were moving quickly. There's, as you're trying to build this airplane in mid-flight, there's not always the opportunities to show folks exactly, show the public exactly what the process is behind the scenes. They need to see the results. Next slide. So as we work through this, the heat map sort of on the left, the highest concentrations of those criteria you can see on the left. So wherever you've got the red, that's the greatest concentration of all those criteria. Where you've got children, you've got the elderly, we've got the highest sample results, and we've got the greatest concentration of lead pipes. And if you look on the right, you'll see our areas of focus for both 2016 and 2017. The hash-marked areas, there's 4 of them that you can see scattered around the city. Those were the first areas we did in 2016 for pipe replacement. Again, based upon the map that you see on the left, as well as the data that it represents, we picked the 10 zones that you see for the RFP for 2017. 10 separate contracts, each with 600 addresses per each one. So 600 addresses. There's a couple obvious areas that you can see that we haven't got to, like below Area 10. You've got a huge area there that looks like some red. And then below Zone 5 that we picked there. Zone 5, below Zone 5 is where Consumers Power was doing replacement pipes this year. Below Zone 10 is what we call the SHPA zone. The State Historic and Preservation Office says there may be Native American remains there, so we have to be careful. We have, with their permission, gone down a few blocks into that as we needed more addresses. But those 2 areas are the main focus for 2018. There will also be, as you can see from your memory, the previous map and on this map, there will be some areas scattered around the city that we have to do as well. Next slide. So comparison between the densities, the one on the right was done on November 30th, again by U of M Flint, in terms of where we have the remaining density of lead. And again, all the you can see we've addressed almost all the areas that we have there. This is obviously not, a metric that you can measure. This is sort of a representation based upon the areas. But we have addressed the main areas of lead density other than the 2 areas that I mentioned. Next slide. One of the things is worth mentioning was our hydrovac results. They were quite substantial. Before we started doing hydrovacing, we were paying the contractors to dig a hole, find out that the pipes there were already to copper, which we did not know because we didn't have the records, and then let us know that, and they fill the hole back up again. That was not a satisfactory result in terms of either time or money. So we worked with the DEQ to do 2 different sessions of hydrovacing. We did a small one. I think it was late 2016, and then we did substantial hydrovacing in 2017 between June and October. You can see that we were able to confirm another 1,130 homes were already copper pipes. That's a good news story for those residents to let them know that they're fine there. And there was another 2581 where we could say, okay, now we know the records. It doesn't add up in terms of the numbers. And that's because there are a number of cases where you can't confirm by hydrovacing. We have curb boxes in the green belt, the tree lawn, that weren't able to be read because there were substantial tree roots that had grown around them. A number were in the middle of the driveway. If we're going to dig up their driveway, we're going to wait until we're actually got a backhoe there and we're prepared to do the replacement at the same time. So there's a number there that we weren't able to do, but this gave us substantial savings at really little cost. Next slide, please. Again, I want to emphasize many of the things. George talked about the CLEAR program. I want to emphasize that one a little bit. When George and I first started talking about this back in, it was early spring of 2017, there was some trepidation on our part. There's the idea that it might turn out that replacing the lead service lines isn't giving us the results that we expected. That even though everyone assumed that was the greatest source of lead contamination, maybe it's somewhere else in the system. Maybe it's something else. Maybe it's the lead in the homes themselves. As I said, there was some trepidation when we began that, but we forged ahead. And said, it's information that we have to know as public bodies and on behalf of the citizens. We have to know this anyway. So I just think that was a huge success story just to be able to do that. The database on the tracking, or our tracker, was something that we put together with the University of Michigan, Ann Arbor. This gives us a lot of data that can be used not just by the city, but by the DEQ and others. For example, on the tracker, they let us know the number of residents in the house, any children, any pregnant women in the house. They let us know if the water meter was replaced or needs to be replaced, and they let us know the interior plumbing composition so that further work can be done as funds are available under CHIP or any other program to work on plumbing within the homes. And those are just representative of all the different data that we compile there for the city to use, not just in the Water Services Department, but within the Public Health Department as well. And then there's the effort to digitize the city's service line records. This was a mammoth effort, in part finding somebody to do it for free. And we were successful in that. There's 138,000 records that have been digitized. So it wasn't just that there's an index card for every address. In some cases, there's an index card every time an address had some work done on it. So you can have 5, 6 index cards per address. These are not all, as you see the sub-bullet there, these are not yet in a form that we can use in a database we can use because some of them, though scanned, are not really readable yet. And we've got to go in and do that manually. We've talked to University of Michigan, Ann Arbor about having some students do this. If we do that, this will be a huge boon for the city to have all their records in a form that can be used in the future. Next slide, please. And just a shout out, when you're looking for donations, whether it's services or goods from around the country, certainly we had a lot. One of the ones that was sort of both a great benefit and a mission distractor, if not detractor, was that we were offered both piping from both the plastics industry and from the copper industry. Spent some time on this late 2016, making an announcement, I think, in March of 2017 at the conference that we held that first week in March. And we went with copper piping. Soon after that, we had been debating this already when we got the effort from the plastics industry, and we decided we were going to hold out for copper. Soon after that, the Copper Development Association donated $1 million worth of copper piping for us to use. Which has also been a savings to the state, we think of around $1 million. Next slide. Next slide, please. Okay, so getting to the nuts and bolts of this, a couple different numbers there that I want to mention. If you look, first I mentioned about the Concerned Pastors Settlement and how that sort of institutionalized the program that we have in place anyway. That requires us to excavate 6,000 addresses by the 1st of January 2018. We've already excavated 8,350, so we're well ahead of the one hard goal that we have left to meet. I need to explain that a little bit because the number gets confused, I think, sometimes. So as you could see from the map, we had a contract for 6,000 addresses. And the contractors, the winning contractors, were given 6,000 addresses. So far, we've given them 7,100 addresses because what happens is they're still finding some that are copper to copper that the hydrovacs were not able to do. this is a good thing in a couple of ways, right? And it means it slows down our rate of replacement, but if you look at it in terms of the rate of determining houses are safe by either replacement or determining that they're copper to copper, then we are well ahead of schedule on that, and that is absolutely a good news story. The other thing that's a good news story is as we get better records, as we refine the records through the digitization and through another round of hydrovacing, we're going to be able to confirm where we have the copper to coppers. Firmly believe, based upon the amount of copper to copper that we have found, and also in discussions, preliminary talks with Rob Binzik as the Director of Public Works, that if that percentage of copper to copper is as high as we're seeing, then we think we'll be able to complete all the replacements next year. Again, just as 6,000 seemed like a stretch goal, especially when you look at the rate that City of Pittsburgh is taking and other cities are taking. It sounds like a stretch goal, but we met that one stretch goal of 6,000, and we're going to meet, I think we can meet the stretch goal of doing it in 2018. We're starting earlier, for example, in 2018. In 2017, we took the month of May, and we did that on the clear homes. Absolutely was the right thing to do, but we had to have our contractors go around and do the homes that were designated by DEQ, replace those first, which means they had to move around the city instead of going straight down the street and going street by street, block by block. They had to do, sort of the onesie-twosies around the city so that we had the clear homes done first, so we'd have time to do all the sampling points over time that George showed you in the map there. So that, again, means that we started later. We're already talking about putting together the RFP for 2018. We want to get that out earlier, and we want to start work in March, April. If we do that, and given what we think is the correct percentage of copper to copper, then our goal is to complete all the service line replacements in 2018, even though we said 2019, even though the concerned passenger settlement agreement says 2019. You always have to have a stretch goal, and that's ours, is to get this done. Looking through those numbers again, you see that I mentioned the total number of excavations. Mayor, I have to tell you one thing, very important. If you look at that number that says 5,929 replacements, that's actually 6,001. So we're over 6,000 replacements, and so we are at right around 5,500 replacements for 2017. The mayor indicated to us to continue working. We are working at least through 8 December, and we're going to get pretty close. We'll get about 96% completion for 2017 if we don't hit the full 6,000. But we're over 6,000 replaced right now. Last slide, I think. I think most of this I've already said in terms of what we have left to do. So I want to, instead of sort of going through this slide, I just want to thank the state, the governor through you, Rich, for providing Major Nick Anderson, Corporal Kyle Baisden from the National Guard on state active duty throughout this period of time. Without them, of course, this wouldn't have happened. Nick has a photographic memory now of every city address and the status of where their pipe is, so I can just, when I get a call or when the phone gets a call, he knows exactly where to go in terms of saying, here's where we are with that. And we, in a project management on a government contract, one of the things you want to really do is contract surveillance. So with everything else they're doing in terms of tracking the data, they were out there in the field just about every day as well doing contract surveillance. And then on that end, I also want to thank Jim Koski for assisting the Fast Start team. Not only was he assisting in terms of contract surveillance, but he actually would sit down with the contractors and say, look, you can do this faster, and here's how. He was a wealth of knowledge on that. And as a pro bono volunteer, driving about an hour in his pickup truck to get over here to do that from where he's currently residing. And then we had, through Kirk Steidel, we had an MDOT engineer, Ryan Doyle, half-time for 3 months at a really crucial time. And he was actually more than 3 months as it worked out in terms of assuring that we had a good RFP. that met MDOT standards for 2017. So with the work of those that we were able to be successful, and that's also with the advice of many other people, some of whom I've mentioned and others. So it's always a team effort, and I want to thank everyone for that. And for my ability, Mayor, to be on this job, I thank you. That's it. Thank you.
I just need to comment and say thank you, General McDaniel and the team. I do have to leave, but you know what? You reminded me of some things that, as to how we started, and I think that's why I'm so glad to have Dr. Pugh as part of this team, because you met with Dr. Mona and Dr. Reynolds was there, and from the medical community, and then you had Dr. Sullivan from the scientific community, and we said that we were going to let public health drive our decision making and how we make policy, and we've been able to do that, and we're continuing to do that, and I think that we are going to set the standard for not just Flint and the state but around the country as to how things need to be done when we're talking about infrastructure and water quality standards. And so I want to say thank you for that. It's also made us better in a lot of other areas when you're talking about technology and what we're going to be able to do, and so we do need to thank others, but I'm just really happy that like I said, that we've added Dr. Pugh, because we always want to make sure we're doing public health and having the scientific community sign off. And when Dr. Hanna talked about how, you know, after Keith spoke and how good that was, it's nice to have the medical community and the scientific community knowing that we're making the right decisions because we're following your direction. We're following your direction, and we're going to continue to do that. So thank you, General McDaniel, for that report. That's a good note for me to leave on. I'm sorry I have to leave as well.
And I also want to thank you, General McDaniel, for two reasons: for the service you provided, and the second one for having a shorter report than George's. I really appreciate that. Okay, we're going to really move through. We have to move through. We have literally 10 minutes left scheduled. We may have to take this over an additional 5 because we haven't met in a while. So if that's okay with the members of this committee, if we can go slightly over, not dramatically over. I know everyone's time is critical. I know that the councilman Santino Guerra had to leave because of orientation for the council members, and so that's you know, so they're busy right now. So Nancy, the ball's in your court.
Very good. I've got some very quick stats for you to hear for both the Medicaid expansion and the CHIP program. Currently, we have 27,700 Medicaid waiver enrollees as of the middle of November. 25,000 of those are in Genesee County. 27,000 of them, 27,200 are under 21, 500 are pregnant women. And since May of 2016, 81% of all children enrolled in the waiver have had at least one primary care visit, and 86% or 88% of all women enrolled since that time have had a pregnant women have had a primary care visit as well. The CHIP program, we have 249 applicants that have been approved, 190 assessments are underway. We have 62 abatements in progress, and 100 abatements have been fully completed. Around 1,000 lead lines have been replaced with CHIP funds, and 398 home environmental investigations in total have been conducted in Flint from all funding sources. 8,700 homes have been abated and cleared for reentry into Flint. And we have also been able to, with the help of TIA, been able to help and train 70 local people to do lead abatement services. So we're making progress. In addition to that, we've got several things that we continue to do in our annual appropriation that deal with the children with elevated blood levels, accepting case management. That's up to 85%. We have 507 people enrolled in family supports coordination, and nearly 10,000 school clinic visits have occurred since we've expanded to 5 child and adult family clinics. So we're making progress, and we continue to work away on these.
Thanks, Nancy. Any questions? Dr. Mona
Sure.
Tisha.
Thank you. So you mentioned the CHIP Lead Safe Home Program, which is awesome. It's $25 million a year for now, probably the next 4 years. This is threatened under the lack of reauthorization of CHIP. So CHIP nationally has not been reauthorized since it expired, I think, September 30th. We could lose that ongoing funding, and part of that is actually funds the pipe replacement. $7 million of that goes to the pipe replacement. So this is currently under jeopardy because it has not been reauthorized by U.S. Congress. So this amazing program that we have to do, primary prevention to inspect and abate homes, could go away if that's not reauthorized. So I would maybe ask us to really reiterate the importance of this to our Michigan congressional delegation, because it's an amazing program, and it's the only one in the country, and we could lose it if it's not reauthorized.
On our level, we've been working a lot with our federal partners
Right.
to make sure they know the importance of the CHIP reauthorization.
But I mean, to us personally, it's $7 million for our
Absolutely.
pipe replacement program as well.
What's the time limit on this? I mean, in terms of reauthorization? I mean, is it now?
Expired.
It's expired,
And
so
many states are sending notices to 9 million children who could lose health insurance. And in Michigan, it's my child. I think Michigan's in a better state, but it's a problem.
well,
States are running on fumes, to give you a picture.
so this is what this committee could do if there was a motion to do a resolution to send to Congress. We can actually do that through
I think
this
that's a
committee.
great idea.
And I'm going to lean on you for the language.
Sure.
Okay. So,
Propose
or
a
Nancy in
motion
their shop.
that the FWICC committee supports the reauthorization of CHIP, especially for the Flint-specific resources.
You made a motion?
Yeah, it's a motion.
Okay, it's a motion. Who's second? Second. Stacy Clayton, we're going to do a roll call.
She can make it nicer. And that would be great if we could send this resolution to our Michigan congressional delegation.
Michigan Congressional Delegation, absolutely.
Dr. Mona, you mentioned CHIP, but we want it on the pipe replacement also,
Well, that
correct?
money is part of the pipe
Okay, that's
replacement.
all right.
It's
Roll
the
call.
first time federal healthcare dollars have gone for infrastructure work.
Okay,
Yeah.
roll call.
So Harvey, just for point of discussion
Sure.
for our vote, please, so I'm assuming we'll send that to Michigan congressional delegations and the appropriate committee?
Absolutely, yes.
Yes.
Okay.
Mark Edwards. Mona Tisha.
Yes.
Harvey Hobbs.
Yes.
Chris Kalinsky.
Yes.
Nick Corey.
Yes.
Jim Kosky.
Yes.
Nick Lyon. Mike McDaniel.
Yes.
Brian Golden.
Yes.
Pamela Pugh.
Yes.
Morris Reynolds.
Yes.
Laura Sullivan.
Yes.
Karen Weaver. Brian Piston.
Yes.
Mark Young.
Yes.
Mike Zimmer.
Yes.
16 yeas.
Okay, thank you, and we'll be in contact in terms of getting the resolution. Once we have the resolution, 15 yeas. Once we have the resolution, we'll send it out to the entire committee, so you'll see the language in the resolution, and we will send that to the appropriate committee and also the members of the Michigan delegation. All right? So thanks for that. Rich Baird.
So Harvey, I believe I can give you some minutes back. Last year, the state of Michigan, through Department of Health and Human Services, contracted with Dr. Sean McElmurray and Wayne State University to lead a multi-institution team that's now known as FWICC, Flint Area Community Health and Environmental Partnership. They were originally contracted to analyze any potential linkage between the source water and a spike in Legionella cases, and the project is entitled Enhanced Disease Surveillance and Environmental Monitoring in Flint, Michigan. The state contracted this team in order to verify or invalidate the hypothesis that the increased incidence of Legionnaire's disease in 2014 and 15 was caused by the change in the water source. Additionally, the scope of the project seeks to reduce the occurrence of legionellosis, hospitalizations, and deaths due to legionellosis to levels at or below those seen prior to 2014. Secondly, to define potential source of Legionella exposure in residential households and high-risk facilities. Third, develop science-based approaches for reducing exposure to Legionella among Flint residents. Fourth, strengthen capacity in infrastructure, institutions, and groups to enhance community resilience in addressing common threats to the health and welfare of community residents. For a variety of reasons, and after several failed attempts to secure a qualified independent Michigan or U.S. firm, the state of Michigan has contracted this week with the Netherlands-based firm of KWR to serve as an external, fully independent project oversight party, to oversee the project being conducted by FWICC, and to recommend what, if any, additional funding needs to occur to ensure conclusions of the project are based on strong research, acknowledging the strengths and limitations of methods used. KWR reps have already met with Dr. McElmurray in the scoping process this fall, and they will be meeting with them very soon now that the contract is confirmed to determine how best to proceed. You'll recall that a team from KWR addressed this body early on in our coming together to share how they remediated similar water quality issues in the Netherlands. They are exceptional folks relative to water quality and have added to their team established epidemiology expertise. This contract is not tendered under Department of Health and Human Services. It's tendered under the Department of Technology, Management, and Budget, and, as I said, is commencing immediately.
Okay, thanks, Rich. Any questions? Seeing none, Kyle, the floor is yours.
Just quickly, in the interest of time, again, we're excited to be able to identify additional resources and to work with our partners at DEQ and the Governor's Office in the Flint Community Schools on the flushing campaign. I mean, it's something that is important to us, it's important to the district, and if we can use Flint Community Schools as a model for other schools in our state, we're excited to do that and get to work on developing what that looks like starting next week. On the food side of things, we are working with our partners at HHS to secure additional funding and complete an interagency agreement with the Food Bank of Eastern Michigan to extend our weekend backpack program that we had last year. The Food Bank has two reports, which I'll get both to Tiffany to share with the group about essentially wrap-ups of how summer feeding went this past summer, which we exceeded our goal by 20% in terms of the number of meals and students served, as well as the weekend backpack program. We exceeded the numbers we expected to serve through that last year as well. We submitted a health endowment fund a couple weeks ago to expand the weekend backpack program for weekend feeding into charters and districts outside of Flint Community Schools. As you know, a large number of students that live in the city attend other districts than Flint Community Schools, so it's important that we reach those students as well. And at our next meeting, we should have both mental health and physical health services data for school-based services within Flint Community Schools that we have resources for. They report on a quarterly basis through our Child and Adolescent Health Center programming kind of data system, so we'll be able to share that at the next meeting.
Any questions for Kyle? Dr. Reynolds.
Yes. No, first question is the Department of Education working with DEQ on the school water monitoring issue? Yeah. And then the second question is, once we've screened children who may have developmental and educational issues, are there plans to increase the capacity of the Flint Community Schools to manage and, do the individual education plans, follow progress as these issues arise over the next 15 years?
Yes, I mean, we understand that we don't know yet, but that we need to be prepared as best as we can moving forward. We've also started to have internal conversations about our educational data that is collected through CEPI to start trying to analyze some of that data to see if there's anything that's telling us in terms of educational achievement through that data. So there are conversations that are happening. Again, I think we're at a point where we realize we don't know yet, and having conversations about what those services or what those needs might look like and at what scale is important to have now.
Okay, thank you. Any other questions for Kyle? All right, Scott.
Good morning. So I'll be very brief. If you notice, I was going to talk in depth about a number of different items, but in the interest of time, I'll just focus on essentially an executive summary. First, we talk about my job for those new folks here. I track all of the actions and outcomes associated with the state's activities, and then also work with the city and the county on their activities as well. And then all of that data then rolls up into a number of different sources. One of those sources that is an online source is the Flint Action Tracker website. If you Google that, you'll find that. Again, Flint Action Tracker. And that is that website, which is we redid over the late summer into the fall. Here is been updated now, and there's a number of, it's a different look. It still contains the same data, but it's a little bit more user-friendly. So I would encourage folks, if you have questions about, again, sort of the outcomes and those key metrics that we're measuring our success on, you can go to that website. Again, it's online, flintactiontracker.com, and you can see that. By way of a few other items, the activities I track nested within all of these different activities, of which there are 350 plus items that I track on a weekly and monthly basis. Two items that are really important to this group. One of those is the Governor's 75-point plan. By way of overall progress, this is important data here. 84% of those 75-point plan items have been completed at this point, which is really, really strong. Of the short terms, and again, those were stratified into three categories: short, intermediate, and long. And by the way, you have this handout in front of you. It's on your desk or on the table. 33 of 34 of the short terms are completed now. 16 of the intermediates, and then we have 14 of 25 on the longs. And that's exactly where we should be right now. There's just a lot of great work that's been done at multiple levels to continue to make progress here in Flint and work across multiple agencies at different levels to achieve that success. Secondarily, the other item I track is the Flint Water Advisory Task Force report recommendations and those outcomes. Again, that's in the lower right-hand quadrant of your one-page dashboard here. And so there we stand, and actually there's a slight change here. We have 7 of those are now completed, vice the 6, and that changed here since the last time we ran this report. We have 7 of those that are complete but ongoing, meaning we're still doing activities against them. And then we have 20 of those are in process or ongoing, as we would define them. And then if you're doing the math, then 9 of those tasks are referred to external agencies, some federal, some county, and some state. So overall, this group would be pleased to know that the Advisory Task Force report recommendations are making progress. And then last but not least is the executive order that established the FWICC. You'll see this handout on your desk as well. This is the executive order status report. And just very briefly, I'll touch on this. There were 12 directives or charges that the FWICC was directed to do or tasked to do by the executive order. We are 7 complete that we can call complete. We have 4 that are complete but ongoing, meaning we're still doing activities because it's important. I'll have to recheck that. Thanks, Captain Klinsky. And then we have 1 that is still ongoing, and the one item that is ongoing then would be the Advisory Task Force report. So in accordance with the executive order, this group continues to make great progress, and these meetings continue to demonstrate our overall outcomes.
I would say that for the next meeting, I would like to have a thorough review of this. So that was a great summary. So we'll come back so the committee members will know. So take some time to read this. I urge all committee members to do that, and if there are some questions that we can get in advance of the next meeting, that'll be helpful to better inform Scott in terms of how to reply and respond to that. Okay.
Just one thing, Harvey. I missed this. I just told Scott that we may have flipped the complete 7 and charges complete ongoing 4. We may have flipped those numbers. We'll double check that, but I just went through and looked at them. I think we just move the numbers around. Either that or the other side of it is where it says complete ongoing, maybe it's complete. So just know we're going to take a look at those numbers, but, so if you happen to see that, we'll look into it.
Okay, and so we're going to move to new business real quick. Just a couple items from me, one item from me. There was some concern again about the subcommittee activities. I sent to each one of you this morning a list of the subcommittees. And it has the subcommittee members and the chair. And so if anyone in FWICC feels that their subcommittee that they're on needs to be active, please contact your chair with agenda items. Those subcommittees can be driven by you all, and as well as what we do at the state. So please do that. Dr. Tisha, Hannah Tisha passed out a card. You want to explain this?
This is a resource card that's in the community for all the resources for children, includes even the Lead Safe Home program, and divided into health, education, nutrition. It's also on the Flint Cares website. So FYI, if anybody wants any more of these, we have tons.
Thank you. I want to thank the signers for participating with us today, and also at the Stacy will send out all the slide presentations that you saw today to all the members of the FWICC, so you'll have that for your records. Are there any other member concerns real quick before Dr. Reynolds?
Yes, as we try to build consensus for some of these changes in regulation and legislation, there's an outstanding issue that still must be dealt with, and that is the presentations that have been made around the state where, if I remember, Bryce Feigner has characterized the Flint water issue as hype. And more disturbing is that the DEQ director, Heidi Gether, defended that conclusion. I've asked repeatedly to see a copy of that presentation and have not seen such, nor have I seen or heard a retraction by the governor or the DEQ director referring to characterizing the Flint crisis as hype and the presentation that stated such as being defensible. That really creates problems when we go before the state legislature and we say children need evaluation over a 15, 20-year period, that lead is a known toxicant and causes damage. So it would be extremely helpful if that would be paid attention to, because otherwise we have these contradictory messages flying around the state and in the national media, and I don't think that's the intention of the governor and his staff, but it would sure help to clarify that.
I would add, and I'll ask Rich to make a comment, that just by the presence of everyone at this table, whatever statements were made doesn't characterize the activity. We don't feel that it's hype. This is real. And I don't know when the statements were made, and I don't have a record of that, but I guarantee you the conversations I've had with folks around this table is taken very seriously. Rich, you want to add anything to that?
Well, Harvey, I think you stated it very well. I talked to Bryce after those comments were reported, and unfortunately, you can't take back what was said, but the context in terms of what he meant to say is that a lot has been printed, some of it misinformation, and that's created an unfortunate situation where it amped up emotions in areas, and he used the word hype, and I don't think that's the word he would use again. In retrospect, I might even ask Keith Cray to comment, since Keith was the director, I think, at the time, or still acting in that capacity. Bryce has had several conversations with many of us, and I wish Mayor Weaver were still here, because the two of them had a conversation after this, and Bryce was truly contrite. He did not mean to minimize the impact of what's happened or the collective effort that all of us around this table and many others are putting toward trying to make things right. But unfortunately, we live in a world where social media can turn a campfire into a brush fire into a forest fire very quickly. And I would just simply say what I always say is, let our actions speak for us in terms of how we're going about addressing the problem, articulating the problem, and trying to support a city that all of us believe needs to be supported.
Mr. Chair, Rich says it well, so if there's anything we need to do, Dr. Reynolds, I think we've had a unified and consistent message before the legislature. I think every presentation that's formal in nature, we have said this is real, that people are working hard, and that we need to focus our attention and efforts to resolve any issues that are outstanding. And so we do have a great partnership on that. So I know that as DHHS and DEQ go before the legislature, there is a unified message there. So if you are running into contradictory messages, let us know. We can talk to those legislators. And there is consistency on the national level. I know with my friends at EPA, we've been very consistent. So as Rich said, Bryce is apologetic for using the word, and he certainly his actions, he's worked very hard and will continue to work very hard as an administration. Thank you.
Thanks.
I would only add that I've had a number of conversations with Director Grouther about this. She was defending the employee, not the statement.
Mark. Okay. Chairman Young.
One of the things that, I look at, and I'm a little bit torn in trying to decide whether or not this is appropriate for this meeting, but, dealing with the lead levels in children, that type of thing. We also have issues where lead levels are also cause more problems for senior citizens that would otherwise be more susceptible to these type of things. And my understanding is that today there were Senate Bills 686 through 701 and corresponding House Bills 5298 through 5313, which tries to reduce the cost of health care, retiree health care on municipalities, but it does this by taking away benefits that had previously been negotiated by different unions and that for people who have given their lives to the community working in the municipalities, and they're trying to end up charging some of the hardest hit people, which are retirees who are on fixed incomes. And I just would like to make a motion to for this organization here to also send out letter saying that we do not support these bills that hit and cause additional hardships to retired municipal workers.
Mike?
I would point to the scope of FWICC and what its jurisdiction and its charging documents contain. This is well outside the scope.
I also would agree with that. This is not within the scope of this committee for those kind of actions. Even at the congressional level, we can make recommendations, but not take a position in terms of legislative support or opposition. That's not the scope here. Commissioner Nolan, you have your light on.
I was going to support his motion, but if it's outside the scope, I'll pull it back.
Again, please look at the charge, the executive order. Read the executive orders. It really lays out the scope and the activity of this. And any resolution that we do really is a recommendation to the governor. So it's not an active body, even though we've sent letters to Congress and to legislators. It basically still is a recommending body for the governor. So, please.
I agree with Mike on scope. I also recognize that people are going to feel strongly about this. I just want you to know, I mean, I was at the center of the Detroit bankruptcy, and we fought very, very hard to keep the folks that would have stripped away the pension and health care benefits from Detroiters, and we didn't get 100%, but we got very close. And we did get 100%, I think, for the uniforms. The point I want to make is that, and I haven't read the bills, Commissioner, so I'm not going to pretend that I have, But I do know one thing for sure, and that is that we have communities all over this state that are having increasing amounts of their tax revenue going for obligations that have nothing to do with the ability of running that city. And the bigger issue that I think these bills are intended to deal with is to preserve folks' benefits and to call the question when entities are not fulfilling their obligations for funding to make sure that those benefits stay intact. But again, not having read the bill, I don't want to attest to that, but I would encourage everyone to read these bills, and if they have an opinion, even though it's not as a FWICC resolution, to participate in the public hearing process and let our legislative body know.
And I would appreciate the efforts that you had done to try to protect those benefits for retirees, that type of thing going forward. And again, frequently what this shows is I don't want to call it mismanagement, but it was a process that previously was not really documented or necessarily looked at. But it's one of these things that I also look at that, if I buy a car and my car payment doesn't start till after January because of some promo, I know that bill's coming due at somewhere down the road, so I try to prepare for that. Here in Genesee County, we've done a fairly good job as far as looking at and making sure that we have the stream downstream to be able to pay those type of bills. And so this really is not necessarily, in my opinion, it's not necessary for the state to dictate to us at this point in time how to fix what is not a problem for us. And it's another story, it's another place, I understand that, and I'll be glad to talk to you about some other point on it. So thank you for your indulgence.
Yeah, thank you, Chairman Young. Appreciate that. Any other comments before we adjourn? The next meeting is on February the 9th. Please get Stacy your agenda ideas and items by February 1, I think, right? So we can move forward. And if we don't have anything to talk about, Dr. Reynolds, then we'll move to the next meeting after that. So with that said, you all please have a happy holidays and be safe. Thank you.